Welcome back. A moment that should be a joyous, life changing experience could be a life threatening one for many Black and Brown women. Maternal mortality is a major concern affecting our country, as Black women are 3 times more likely to die from pregnancy related issues. Founder of Ashe Birthing Services, Emilie Rodriguez, joins me to discuss New York City laws meant to lower maternal mortality rates amongst Black women. Emily, thank you so much for joining me.
Thank you so much for having me.
Now, can we first just start off talking about, maternal mortality and what that actually is?
Yeah, maternal mortality is the death of a woman or birthing person in pregnancy, birth, or up to 6 weeks postpartum.
Now, I'm curious to know, is this something that happens often? Like, is it a high possibility that when you go into birth that this could be an outcome?
I would say statistically no, but it's higher than what it should be. Nationally, the average of Black women dying, in childbirth is 3 times white counterparts. But in New York City, where you would think we would have the best outcomes in the world, it's one of the worst for an industrialized nation. And so, our maternal mortality rates are about 3 years behind, and those are 8 to 12 times white counterparts.
Wow. Now, can you explain why this has been a long time issue and concern for many African American women?
Well, it's not because of social determinants of health. It's not because, just our race. It's really racism within the medical industrial complex, also known as the hospital.
Wow. Now, I know that a lot of Black and Brown women fear giving birth in hospitals due to neglect, and it could be that racism that you're talking about. Can you just explain how this is linked to the many years of systemic racism within the health system?
Yeah, I mean, I think that starting with the eradication of midwives in the 1920s and the start of like medical schools, we started getting away from, really important information that we knew about birth. And doctors and training, miss important parts, like actual informed consent, which I often don't see happening in the hospital, learning how to diagnose things based off of people's skin color. They only learn off of white skin. Um, so I think that like that paired with implicit biases, we see racism within the school, and then also that translates into the hospital. And so neglect is just one part of how racism manifests in the hospital system. But, when we see people like Beyonce and Serena almost dying in childbirth, we know that it's not because of other factors. It's really just racism.
I'm really glad that you pointed that out because I know a lot of people tend to just automatically think this is possibly like a low income issue or something that's only facing low income people. But you just mentioned that two of like, the hugest celebrities in the world also face this. I'm curious to know, I know that I've heard like, throughout my classes that a lot of health professionals think that Black people have a different pain tolerance or, there's a lot of things that relate to that. Can you talk about that a little bit?
Yeah, I mean, that's from slavery. We do not experience pain differently. We are not super women in the way that they are talking about. And, I think that something that's really important is with birthing people, we know our bodies. We know our bodies. And so this should be a collaborative relationship with our medical providers, whether it's a midwife or an obstetrician, because there are midwives in hospital systems as well. And so I think that it's important that, people do the individual work to perform the proper care so that they're listening to all of their patients and they're recognizing that everybody has implicit biases and that doesn't make you a bad person. But, there's a lot of unlearning to do, if you were brought up in this system. And it's our responsibility to do it, so that people are listened, they're believed, and therefore we can have better outcomes. I think that the city is trying to say that like doulas are the answer. And while we are a really pretty band-aid, I don't think that, we're an answer for racism within the medical industrial complex. So we do our best to, triage, if you will, the situation to help this pandemic, really.
I'm really glad that you brought that up because that kind of leads into my next question. I know that Mayor Eric Adams is in the process of signing 7 bills created to lower maternal mortality, and I know that doulas is a part of that. Can you just tell me a little bit more about that?
Well, I think that the council has worked really hard, and it's being pushed by Jamal Williams and also Bronx Borough President um, Vanessa Gibson. And she means business. I think that as soon as she started office, she reached out to all the local doulas and midwives in the Bronx and was like, okay, how can we solve this problem? And so I'm appreciative of these laws. I know that they worked really hard on them. I think that they're a great start, although I absolutely have critiques and things that I would like to see amended.
Can you tell us a little bit more about the critiques? Because I've also seen this work, and in my time, I've heard a lot of people say amazing things about doulas. Can you just tell us a little bit why you're kind of have these thoughts that you're having?
Well, I think one thing that pertains to my field is that, doulas are independent, they're like independently contracted, they're self-employed. We don't represent anyone but the person who hires us, the family that hires us, right? So it becomes a little problematic when like hospitals are employing doulas because then, whose agenda are we serving here, right? Is it the hospital policy that they don't want us to counter that's not evidence based, or is it our clients' wishes and our clients' desires and our clients' voice that we're advocating for? So I think when I see certain things about regulating doulas, training doulas, I naturally have questions about who's doing those trainings, how are we regulating doulas, and if we should be doing that at all, which I don't think we should. But I do think that all of these bills have a beautiful voice and a start, and are going to make a big difference. And I'm happy. Like this is not a new issue. This is something that we've all been fighting for decades. I'm really happy to see it at the forefront of our news today.
Now, for those who don't know, can you just tell us what doulas are and how they may differ from trained nurses?
Yeah, so a nurse, a midwife, an obstetrician, those are all medical professionals that, do amazing different jobs. Doulas are non medical professionals that provide information, physical support, emotional support, mental support, sometimes spiritual support, and advocacy for people during pregnancy, birth, and postpartum. And so that looks different for every family depending on their needs and where they are in life. And so we kind of become like a best friend for people during that period that knows how to navigate the system, that knows who to go to that's safe, where to get a VBAC in New York City, or where to what options you have. A lot of times when people are pregnant, they don't even know that they have options because they go in for a pregnancy test to confirm pregnancy. And they're like, okay, great, we'll see you on Monday at this doctor's office. But you have options, that no one is telling you. So unless you have a doula, which is not very many people, or you have a friend that's telling you, oh girl, like you can go to a hospital, you can go to a birthing center, you can have a home birth, right? A lot of times people don't know what their options are, and doulas help fill in that gap.
Now, I know you mentioned in an article that only 7% of people in New York City have doulas. And despite, having so many amazing qualities, why do you think that these services are so low, especially in New York City?
Well, I would say that the word doula might be new, but the traditions around like being a birth worker are not. They used to be our aunties, our mothers, our grandmothers, our neighbors that would care for us, during this period. And the history and the traditions were rich. We knew about pregnancy, we knew about birth, we weren't afraid of it. Nowadays, with like really bad sex education growing up, there's a really big learning curve when it comes to pregnancy. A lot of people don't know very much about it until they're actually in that situation. And they don't know about doulas either. So I think that that's an access problem. And I think that we're starting to hear more and more. I'm getting into conversations with people where they're like, oh, you're a doula, that's amazing. Whereas before I would have to explain from scratch. So I think that it's becoming more and more known. But I think the thing that people don't know is that it's not a luxury item. That doulas in New York City, we barter, we do sliding scale. There are free doulas from the doula initiative project in New York City now under Mayor Adams. Um, there's a lot of grassroots work that's happening, and you can get a doula at any budget. And it's really a birthright to have support in birth.
I'm so happy that you mentioned that because I know the first time I heard it, it was in a television show and the women were rich. So I thought it was definitely something only available to rich women. So I'm so glad that you pointed that out. Can you just explain the importance of having a birthing advocate or just knowing how to advocate for yourself when you're giving birth?
Absolutely. Like I said, in 10 months of pregnancy, there's a lot to learn. And so I think that a lot of folks think that they can go into a hospital and they're going to be taken care of the way that they want and that they're going to trust their provider fully. But as you see with these statistics, you really need representation. And I don't know anybody, even myself, who could properly advocate in active labor. And partners, if someone has one, they don't necessarily know what to advocate for either. And so these are all conversations that we're having during like prenatals together and getting to know each other, like walking together in pregnancy, so that I know when you're in the labor room, like what your desires are. If there's previous sexual trauma and it's really important to you to be spoken to before about like what someone's doing to you before they do it, for example, which is very common. Or it's really important to me that no one's yelling at me. Or skin to skin is really important because I want my baby to have delayed cord clamping and all of their blood after giving birth. And I don't want anyone to cut the cord prematurely. I want to make sure that like evidence-based information or evidence-based science is being practiced. And like, I don't know if I'm going to be able to like watch my own medical care and, give birth. Or if they are feeling symptoms, to be aware of it. And, even though we're not medical professionals, we definitely don't have the luxury as we're discussing in just being that, we know a lot of medical knowledge. We know what to look out for. We know what the signs are. And so having, a fresh pair of eyes that is looking out for only your health, does not have 9 other patients, to make sure that you are not just alive, because I feel like that's the bar that we talk about with outcomes is like,
Right.
well, is the birthing person alive? And I think that that's a really low bar.
Right.
It's important to talk about, do you feel safe? Do you feel well taken care of? Did you feel empowered through this experience and this huge transition into motherhood or parenthood? And I think that that's where we really fill in the gap there.
All right. Emilie, thank you so much for joining us.
No problem. Also, if I could just add one thing, is that okay?
Hum?
Can I
Oh,
add
yeah,
one
you
thing?
can add it. Yes, quickly.
Okay. So, in addition to talking about, all these problems that New York City has, I think it's also important to talk about solutions. And one of the solutions that we created is the Bridge Directory. And that's how Black and Brown birthing people in New York City can find providers of color that like understand their culture, that speak their language. And it's a completely free resource. So I would love to let New York City and the Bronx know about that.
All right. Thank you so much for joining us.
Thank you so much.
We'll be right back with more Open BxRx Tuesday.